Hello, welcome or welcome back to my channel. My name's Ashmita, and if you didn't know or if you've just stumbled upon my channel or video, I'm currently doing a series on the coronavirus pandemic known as Living in the Pandemic. This is currently the 5th episode of the series, so if you guys haven't watched the first 4 episodes, I'll link the videos down below in the description. So in this video, I'll be talking about policies. In the previous video, I talked about global policies uh, in terms of responding to the pandemic. However, in this episode, I'll be discussing how specific countries responded to the coronavirus pandemic. The countries that I'll be discussing in this video are China, South Korea, Singapore, India, Africa, New Zealand, US, Germany, Sweden, and finally the UK. The first country that I'll be discussing is China. So Wuhan, which is in China, was the epicenter of the disease. So the government of China enforced a lockdown/corridor sanitaire around Wuhan and neighboring cities in order to ensure that the disease didn't spread to other parts of China. So a cordon sanitaire is basically a guideline that prevents anyone from leaving or entering the premises so that the disease doesn't spread. But there were also entry restrictions done for major Chinese cities. They dealt with imported cases through quarantining and isolating them. And on top of that, they also isolated or quarantined people who were in close contact with the confirmed cases. The next country that I'll be discussing is South Korea. So South Korea enforced contact tracing early on. So Daegu had the most cases, and the cases arose from a church. So members of the church were ordered to isolate themselves, and thousands of individuals in Daegu had to be tested. The most serious cases were sent to hospitals, and the patients with milder symptoms were sent to isolation units. There was also a combination of interviews and cell phone surveillance done in order to track down the contacts of new cases and also order the contact cases of previous cases. Finally, they implemented high-tech contact tracing, where basically the country's capital, Seoul, sent out messages notifying the number of cases each day, and individuals could also check the district website in order to see the routes of the new cases and previous cases. In addition to that, it also notified them their age and gender, as well as if their houses were disinfected or not. The next country that I'll be discussing is India. On the 24th of March, they declared a nationwide lockdown, and this lockdown was originally for 40 days. However, this lockdown period was extended for 19 more days on the 14th of April. On the 24th of April, public works, farming, and banks were starting to reopen. And on the 25th of April, neighboring shops were reopening. The transport was still suspended nationwide. However, enforcing social distancing in a country like India is quite challenging because of its dense population, and a lot of the people actually live in slums. So Africa's policies were slightly different as to how they responded to the coronavirus pandemic. They had a team called the African Task Force for Coronavirus Preparedness and Response, which was a continental approach with the Ministers of Africa, the WHO, and other partners. It was co-led by member states, the WHO, and the African CDC. The team had 6 different roles, which include laboratory and subtyping, surveillance and enhanced port of screening, infection control and prevention, clinical management, commodities, and risk communication. So the laboratory group basically organized trainings to ramp up testings from 2 to 43 countries in just a month. The infection control and prevention team had competency-based trainings of trainers in Nigeria. The care and treatment group basically trained a lot of communities by practice. So Africa's main strategy was to build early detection and containment, and then expand on more testing in order to identify the new cases. So New Zealand also had a significantly different approach to that of other countries. New Zealand was the first country to declare coronavirus free, which meant that they have 0 cases for a week now. They had a harsh lockdown since the start, so they encouraged people to stay at home. Non-essential businesses were closed. They were allowed to exercise in their neighborhoods, but swimming in public beaches were banned. Borders were shut, except for residents and citizens who were returning, and those who were returning had to serve the mandatory 14-day quarantine period. And finally, they implemented widespread testing and contact tracing. The next country that I'll be talking about is the US. So the US didn't really have any temperature checks done, or they didn't really monitor any symptoms in the airports. However, on March 13th, President Trump declared a national emergency. He also implied on using critical supplies such as masks and gloves for frontline workers, but they didn't actually use them. There was also a very low amount of diagnostic testing done, and there was a significant shortage of PPE. In addition to this, the White House also declared that they would let state governors take over the decision when it comes to responding to the pandemic. And the US was under lockdown. However, they are planning to reopen the economy. Currently, cases in the US have increased over 1 million. Out of all the countries I've discussed so far, Sweden's policies differ the most. So basically, primary schools were open, but high schools and universities were closed. Restaurants were also open, but the tables had to be spaced away from each other. And nightclubs were also operating, but people had to be at an arm's length distance from each other. They were also encouraged to work from home, and people who were over 70 or ill were encouraged to stay at home. What they implied was that it was the individual's responsibility to socially distance themselves, and that the government would ensure that the society still functions. The last country's policies that I'll be discussing is the UK. So on the 4th of March 2020, the UK basically encouraged individuals to wash their hands for 20 seconds, especially after they come back home, before they eat, and after they blow their nose or sneeze. They also had to socially distance themselves, so they couldn't have family gatherings or gatherings with friends. They could not use the public transport if it was not needed. Individuals also had to ensure that they didn't have any contact with symptomatic cases. They were also encouraged to work from home, and they had to use the cell phone to contact the GP as well if needed. Individuals were encouraged to strongly avoid going out if they were over 70, had a current illness, or they were pregnant. So finally, the UK moved to a lockdown period where they had to work from home. They couldn't visit restaurants or pubs, and they couldn't participate in social gatherings at all. This was effective in controlling the virus, and now they are planning to reopen the economy. So that concludes my 5th episode of this series. As always, if you guys have any questions, comments, or thoughts, please feel free to leave them down below. We're done with the policy aspect of the pandemic, so in the next few episodes, I'll be discussing the psychological impacts, social impacts, and the epidemiology of the disease. Until next time, see you. Bye.